All right, couple of special guests from Barton. I've got the CFO and the CEO, Kelly Neiger and Dr. Purvance. Guys, thanks for taking time to join us.
Thank you.
Thank you.
So we're talking about the relocation or the move across the state line. What do you need to know?
As far as insurance goes, if you come to our hospital through the emergency or you're admitted for acute patient services, we're able to see patients from across the state line. So if we're in Nevada and you're a California resident, that doesn't change. Currently, our Nevada residents on the South Shore are able to come to our California hospital for those services.
Dr. Purvance, when somebody sits there and says, hey, is my insurance going to be covered? I'm currently on the California side, can I be seen on the Nevada side? What's the answer to that question?
Well, the answer is yes, Pete, and we're designing a system so whether you need the hospital services, and we can see all patients, and we see patients from outside of California, Nevada in our hospital every day. But we can take care of you when you have your acute care needs, but we're really designing the dual campus model so that we have outpatient physician clinics, laboratory radiology on both the Nevada and California campuses to serve patients close to home and in the state that they reside.
If I'm not wrong, most insurance companies also have border provisions?
Yes, so that would include Medi-Cal, covered California plans, and some HMO plans. Now, what we're doing right now is we're working with these plans to ensure that we have those border provisions within our contracts. So what that means is if you were to cross the state line, and let's say it's not for emergency, but you need to have an outpatient surgery or something like that, those services would be covered with those border provisions in place.
What's the timeline? When is all this going to take place? For real world, for planning purposes, right? When should I start to expect some of these changes to become effective?
Well, the changes are being planned today. So as an example, we're expanding our rural health clinic on the California campus in 2025, and we hope that in third quarter we'll almost double the size of that clinic, serving both primary care and then specialty doctor care on our California campus. We're also planning additional exam rooms and clinical services, primary specialty care on the Nevada campus for late 25, early 26. And then of course the hospital project, being a much larger project, is one that we're hopeful to have in operations within the next 5 years.
If I want to know if my insurance, which side of the state line I should come to, where do I find that with my insurance provider?
So it depends on what type of plan that you have. So if you have an HMO plan, you're typically going to be covered in the state in which you live. Many PPO plans allow you to cross the state line, so you shouldn't have any problems with that.
All right, that's the CFO and the CEO from Barton. Big changes coming here to the South Shore.